Here at the Cork Care Clinic with the owner, David. What would you say would be the five main benefits someone would get from coming for a couple of sessions with the Care Clinic?
Um, so especially you get pain relief from if that's the main target for my treatment plans
Pain and
is to
injuries kind of
pain and
stuff.
injuries and
Yeah,
stuff like that. With any type of treatment, you do get some form of kind of relaxation, I guess,
yeah, yeah.
more rehab.
Mm-hmm.
For those type of players that are kind of coming from a sports perspective, I'm
Yeah,
trying to get them either back on the pitch, back on
yeah.
whatever perspective.
And is it
Like
mostly sports or is it like work injuries as well or just
working,
like
yeah, no,
repetition?
everything can come in.
Yeah,
Work injuries, you can have a lot of people, especially in today's generation, without standing desks. We have our seated haunch, and
exactly. Yeah.
you can get into fairly bad posture. So like we're not just treating the patient in the room, we're also
Mm-hmm.
kind of trying to advise new kind of ways of like the ergonomics in the workspace,
Yeah,
mobilizations, stretches, and strength and conditioning
yeah.
that can be added into their life.
Okay, so it's like putting permanent solutions in
Yeah,
place so
yeah,
we can
yeah,
like
yeah,
fix it kind of
yeah.
long term.
Try to make sure that after the treatment that that they're not coming back straight away for another bit of they can do stuff on their
Yeah,
own as well, and kind of giving the confidence to the patient to
yeah.
know what
Yeah,
to
and if
do,
people
like
are watching, like what kind of things could they be doing at home if they have, say, like back pain or some injuries?
So
What would
back
you recommend?
pain, let's say you could do very easy stretches, knees to chest, knees crossover. Just depends on, let's say, if the person has a herniated disc.
Yeah.
Advising if make sure you get checked before doing any of the stretches and stuff like that.
Mm-hmm.
Child pose, all the kind of Pilates stretches and stuff
Yeah.
like that are
Yeah.
very helpful.
Mm-hmm.
Yeah, just to kind of keep mobile, and staying in the one spot and stuff like that is usually not good.
Yeah.
You'll seize the body up a lot more and cause more stress. So
Yeah.
yeah, like it's they're kind of keep moving,
Yeah. Keep
keep
moving,
mobile, keep
exercise.
moving, yeah,
Yeah.
exercise.
And if you had to like quick fire off like 10 conditions that people, if they have them, they should come and see like an osteopath,
An
what would they be?
osteopath. So any type of disc herniation, osteoporosis. You could have, let's say, ACL injuries, post ACL injuries, knee injuries, shoulder injuries, neck injuries.
Mm-hmm.
Someone has the likes of kind of headaches, or let's say female versions, hormonal like things
Yeah.
that happen throughout the body.
Yeah.
Very common, especially post menopause,
Mm-hmm.
perimenopause.
Yeah.
Those you could have injuries for kids like Osgood Slatters. You could have any injuries post surgery,
Yeah.
anything just to rehabilitation.
Yeah.
Especially those that are kind of coming of age where the bones can kind of come a bit more brittle due to
Mm-hmm.
reduction of hormones and stuff like that. So kind of osteoporosis, osteopenia,
Yeah.
they're big ones that we see.
Mm-hmm.
And they're ones that you carefully need to take into, because if the bone is quite delicate, you can't just be
Yeah, you need to put a
rough,
careful plan in
yeah,
place.
yeah, it's back, yeah, exactly.
Yeah, what would you say to someone that might be watching this and they're 50-50 about whether they need to get some sessions, and like what would you say to those people like that are on the fence
Give
about
it a
seeing
try,
someone?
especially if you're in pain, if you're feeling any dull aches and niggles. It's kind of preventative as well.
Yeah.
You don't like if you can feel something come on, you don't need to just be in pain to come.
Mm-hmm.
Like a lot of people come because it's preventative.
Yeah.
They've been here probably before because the pain has got very bad.
Yeah.
They've gotten better from the treatment, but now they just come either once a month or
Yeah.
whatever, every 6 months or whatever like that, just to keep the pain at bay.
Yeah.
Keep mobile, keep supple, and
Yeah. So if someone's like training for a marathon and they can feel an injury coming on, you want to like get into it before it happens.
Especially for the Cork Marathon coming up.
Yeah.
We have a few runners and a few ultra runners coming.
Yeah.
So like the likes of kind of like plantar fasciitis, Achilles tendonitis, any tendinopathy.
Yeah.
That can become very easy problems.
Yeah.
Especially when you're putting in heavy miles coming up to the final marathon.
Yeah.
These are big things where we can just kind of prehab the body and kind of strengthen the body as well. Like
Yeah.
So these are things that where yeah, it's our bread and butter.
Yeah, and like a quick one. So like how did you decide to be an osteopath? Like what would your backstory be?
So I was a personal trainer and fitness instructor for about 6-7 years.
Yeah.
And I kept getting kind of older patients.
Yeah.
These older patients had lower back problems. They had stuff, and I was like they're coming into me, but they're in pain, and I'm like, there's nothing I can do.
Yeah. Yeah.
So I kind of looked up things. I was like, right, what kind of things could I start adding in and stuff? And I went quit the fitness
Yeah,
industry
yeah,
completely,
yeah,
and I
yeah.
went straight into osteopathy.
That's nice.
So
Yeah.
I'm on my final year now of osteopathy, but you can still add into,
Yeah.
or the second, sorry, I'm in my fourth year in osteopathy.
Yeah, yeah. And you've got 25 five-star ratings on Google, so
Yeah,
you must be
thankfully,
proud of that.
I might be doing something right.
Yeah,
at least.
that's the job, yeah. And
Yeah.
how can people get in touch with you? You've got two places. You're in Douglas on Mondays, and then you're up by the Neptune as well, is
Yeah.
it?
So Mondays is 9 to 4 in Douglas, where we are today.
Yeah.
And then we do Monday to Friday evening, 6 p.m. to 10 p.m. In Neptune Stadium, the north side of Cork.
Yeah.
And then let's say if anyone wants to get in contact, phone number is 083 868 8136, or the website is www.corkcareclinic.com.
Yeah.
Then obviously all the social medias, TikTok, Facebook, and Instagram.
Exactly, that's the job. And I had a session with David as well, and I feel like immediate relief in the back, a lot more freedom. So I would recommend it if you're thinking about it, to come for a session.
Thanks very
so
much.
thanks very much, David.
Thanks very much.
Yeah, nice
Thank
one.
you.